Good morning and welcome to This Week in Digital Health. Our guest this week is Alex Young from Virti. Alex, what's going on?
Really great. Thanks so much for having me on. It's been a very exciting time for us. We just closed a Series A investment round for Virti in a sort of in scale-up mode. So lots and lots going on to answer your question.
So tell us a little bit about your background and why you launched Virti.
Yeah, sure. So my background originally, I trained as a doctor and did trauma and orthopedic surgery in the United Kingdom in the National Health Service. And when I was training, I had a couple of companies in the education space, and then left clinical practice round about 2.5, 3 years ago now to found Virti back in 2018, really with a mission to revolutionize how any workforce, but particularly the healthcare workforce, learns, trains, and performs, on a mission to kind of transform how experiential learning is scaled and consumed by doctors, nurses, any healthcare professional on the front line. And one of the reasons that I was very passionate about that mission was because, having worked in the National Health Service, which is one of the biggest employers on the planet, there's a huge amount of people who work very hard, whether it's nurses, doctors, auxiliary staff, you name it, who often either don't have time for training or who don't receive the best methods of training possible. So for something like surgery, which is what I did, it's very serendipitous what you will receive teaching or training on, depending on what day of the week or which hospital you go into. So someone who sees some very unique operations will be more adept at performing them than someone who is in a smaller hospital or in a different country or different time zone. So one of the key things I wanted to do with Virti was create this on-demand experiential training platform that allowed people to access content regardless of where they were geographically, standardized training, and also make it a lot more data driven by understanding how people perform at scale across an organization. And that's sort of what we started building back in 2018.
And how did that sort of shift? Because I know that the product includes extended reality and AI. So you've moved a long way from building a platform for that.
Yeah, absolutely. I mean, the appetite for day one was, how can we take existing in-person training and scale it digitally while collecting data points on how people learn and train to then predict how they're going to perform when it matters in the workplace. And in healthcare, obviously, there's a lot of patient safety linked to that. So if doctors and nurses can be shown to be safe and be up to date with the latest training standards, any kind of adverse events can hopefully be avoided. There's also an element of reducing things like burnout by ensuring that doctors and nurses are better prepared for when they go into high stress environments. So a little bit of kind of performance coaching.
And do they do that in the virtual environment first? That gives them
Exactly. So in terms of the technology, what we sort of started building out originally was very much like a performance dashboard for the workforce. So if you think along the lines of a learning management system, you're on the right track. And that then allows educators or trainers or L&D staff to use some no-code tools to create either video-based training or computer-generated extended reality training. And then for the actual users, the learners, the healthcare professionals, they, from their mobile device, from their desktop computers, or from their VR or AR headsets, can be put into these on-demand, repeatable training scenarios, like assessing a patient under pressure who comes into the emergency room, or breaking bad news and practicing soft skills in these very realistic high pressure environments. And what our system can then do is it can look at decision making, look at leadership skills, look at soft skills like communication, using some of the AI components. And that then is transformed into a score that allows for comparison between individuals and for organizations and trainers to see which areas of their workforce is best trained, who might need a little bit more help, and what specific skills they might be lacking.
And when you launched Virti, what support did you get? Did you go through an accelerator? Did you, how did you develop the MVP?
Yeah, so we originally kind of very much bootstrapped it. So I'm based in Bristol in the United Kingdom, and built a very small kind of tech team of around about sort of 4 or 5 people initially when we launched back in 2018, but got some pre-seed investment from some investors in San Mateo in Silicon Valley, and actually went out there very early when we were building the technology, seeing the US as one of our major markets in terms of healthcare and beyond. And then subsequently started making sales quite quickly, actually, which is a little bit unusual for a very early stage company. Saw that we had product market fit and then started scaling up. So we went through an accelerator in the Texas Medical Center, which is one of the biggest sort of areas on the planet in terms of concentration of hospital systems. That was an equity-free, sort of very value-driven and competitive program to get onto. So we were very lucky to get onto that. And back in the UK, we also got onto a similar equity-free program through the National Health Service called the National Innovation Program, which sort of takes evidence-based companies that help healthcare organizations to tackle a number of different issues through digital technology. So both in the United Kingdom and in the United States, we had lots of access to different markets, different areas, and we're able to scale up and build out our sales teams around those bases.
And I noticed that you mentioned equity-free twice. So how important is it to you as a founder to preserve your equity?
Yeah, hugely. And I mean, I think, to anyone listening who's starting off in a digital technology company, especially like myself as a solo founder, I think not giving away too much equity, certainly at the beginning of your journey, it is really, really important because that helps you to maintain your autonomy and maintain your decision making at later stage investment rounds. So we were very cautious on that. And I think part of that was because my previous companies I had bootstrapped, around my job as a trauma and orthopedic surgeon without giving everything away. And I was probably doing far too much and learning lots and lots, which was great. But with Virti, I didn't want to, give away a huge amount at the beginning. And then we were very fortunate with subsequent investment rounds that we always had revenue, we always had product market fit, and we always had traction, which meant we could run very competitive investment processes.
Yeah, I mean, we've actually had a client come to us and looking to raise money, and they had already given away 15% to advisors, and I'm like, like I can't do anything with that, So I was just very keen to the fact that you mentioned, equity free and preserving that, and obviously from lessons learned, right?
Absolutely. I mean, I think, for anyone listening, as you say, Mike, there will be, there'll always be times where, you feel stressed, you feel you need something to kind of move your company forward, especially when you're, just an idea on paper. And it can be easy or seemingly easy to say, I'm going to give away some equity to an advisor, to, an accelerator program, whatever it is, and then assume that's going to massively help you. But the thing that will massively help you the most is simply rolling up your sleeves, building a really solid foundation, getting your tech and product market fit from day one if you can. And there are these equity-free programs, like I mentioned, out there. You just need to find them and then maximize any benefit from them.
And then when you went out to raise your Series A, how many investors did you end up talking to?
Yeah, it's a really interesting process. So I originally basically kind of booked out almost 6 months of my diary where I was going to be kind of almost out of the business,
Sure.
which is quite challenging as a solo founder to really get that done and get it raised. And when I sort of started planning the process, I expected to speak to, between 50 to 100 investors, some of whom we already had on our sort of investor updates list, some of whom we knew we were going to be reaching out to cold. And because of the sort of state of the business, we'd grown very, very quickly. So we scaled up around about 1,000% in 2020, mainly in the US, actually. What ended up happening was, without me really expecting it, we had lots and lots of interest in the round, and it ended closing in around about 4 to 6 weeks rather than 4 to 6 months. So it was pretty crazy.
That's not normal.
No, it was nuts. I mean, I still ended up speaking to probably around about, I would say, had coffee meetings with around about sort of 30 to 40 people in quite like a defined period of time, and then sort of quickly moved to the investors who we were very, very interested in, who we felt completely understood our mission, our goals, and could help us in terms of either hiring or scaling up and introductions for revenue.
And were you doing this during sort of the COVID lockdown period?
Yeah, so that in itself was really interesting. So
Okay.
when I'd raised our seed investment round back in 2019, a lot of my time was spent on a plane or on a train or some sort of transport, going to meetings and meeting people. And that in itself is hugely time consuming. And for the seed investment round, again, I probably spoke to around about 50 to 100 people, probably more so. For this one, because it was during the pandemic, absolutely all of my investor kind of coffee calls and meetings were done over Zoom. So I'm sort of split my time between the United States and the United Kingdom. Through 2020, I was fully in the UK because of the pandemic. So I was doing calls literally deep into the night in some cases, depending on what time zone investors were based on. But it was very, very efficient because you could get through a lot of meetings. And I think that definitely accelerated the process. I think the downside to that is you do obviously lose the rapport of going and meeting people and speaking to them. And certainly, when you're down to probably 10 or so investors who you like and they like you, it is really important to still go and speak to them. So I was reasonably fortunate in that in the United Kingdom was a period just before Christmas in 2020 where travel opened up, even if it was just for about 3 weeks before they closed things back. And I was able to go and again meet a lot of these folks in person before I made a final decision.
And why is it so important to like the investors? It's money, right?
100%. So, I think there's a couple of factors here. So, I think firstly, they are going to really be part of your team going forward. So, if you bring someone onto your cap table, it's very unlikely that they're going to disappear, or if they're sitting on your board, you're going to be speaking with them at least 6 times a year, probably more. And so actually just getting on with people who support you is hugely important, especially for the founder of the company, where things are not always going to go well. We were obviously very fortunate in that we were on a big uptick, but at some point in the future, I'm sure we're going to have some problems we run into. So we want people who are going to sort of support you through the thick and thin and have your back and really focus on the mission. The other component that we were looking at was we wanted someone who was able to kind of understand the technology. So as you mentioned, we use AI, we use extended reality, which itself is quite technical, quite complicated. And some pure sort of financial venture capitalists might not understand that, and therefore they might sort of make assumptions, and again, they might not be able to support you in the best way possible. So we were really after someone who got the mission, who understood the technology, who we got along with, and we were very fortunate in IQ Capital, who ended up being the lead investor, and we also had Cedar Sinai in Los Angeles participate in the round, following on from our seed round. Have some really great people on our board who basically make the process fun, which for me was the most important thing, because that's what building a company should be about.
And what we saw was sort of an explosion of funding in the digital health space as a result of COVID. Did you think you benefited from that?
Yeah, it was really, really interesting. So, back in 2019, our sort of marketing spiel was all about how do you digitize in-person training, or why are you spending so much time, money on doing in-person training when you can reduce the time, reduce the cost, improve the data by digitizing a lot of that. I was actually out at Cedar Sinai in Los Angeles in February and March of 2020, when California went into a stay-at-home order and lockdown. And it was very interesting. We were doing initially a lot of generic healthcare training, so things like line insertion for nursing staff, things like communication skills for doctors and nurses. And then suddenly we had to really align to the hospital's own pivot in how do we sort of update their staff around how to put on protective equipment, how to communicate and deal with patients with the COVID sort of protection requirements that were going on. And to give everyone listening an idea of what that looks like in normal practice, all the doctors and nurses, of which is sort of 10 to 20,000 staff, had to come down to a physical environment and be physically shown how to don and doff protective equipment, how to enter and exit a room when you go in and see a patient, and that's incredibly inefficient. And obviously, it's just a one-off episodic piece of training where if people come down, they quickly put it on, they get signed off, and then they leave, and then they're sort of expected to do it properly, when it matters. So we're very humbled to sort of be able to help Cedars and a number of other organizations digitize a lot of that, so that not only could they improve the efficiency of that flow through of training, but also all of the healthcare staff had the training on demand on their mobile phones, sort of just in time training, to ensure that they were safe, they could do it properly, and also really to kind of reduce anxiety levels, because thinking back to when things really kicked off and got serious with the pandemic, there was a lot of anxiety in the healthcare workforce around what happens if I get infected, if I don't don and doff my protective equipment properly. Am I infecting other patients? Am I going to get infected? Am I going to go home and infect my friends and family? So that just sort of gives you an idea about what we were doing. And then absolutely, with the wider sort of training push through 2020, we absolutely were able to kind of help multiple organizations and hospital systems scale up things like their soft skills training when you couldn't do in-person role play and things like that, and then ended up being sort of featured on the NASDAQ tower in Times Square back in May of last year, which was really cool, for some of the work we did with the frontline healthcare workforce, which was brilliant.
And what is sort of, talk a little bit about the metrics that you're capturing and the feedback that you're offering, and why is that so important?
Yeah, great question. So I think I always liken it to when I was training, or when I was practicing things like soft skills or communication skills. So something like breaking bad news to a patient is incredibly important, and if it's done poorly, it can lead to a very negative patient experience with the whole healthcare system. And so how that's delivered normally in practice in person is often using role play with actors or actresses, and a healthcare professional would come in, they would practice a role play, then they would go away, and hope they remembered some of that. What we want to do, and what we have done with some of our analytics, is by digitizing that with things like computer generated avatars, where you can actually converse with an avatar in a virtual reality headset or on your mobile device. The AI will analyze people's conversation, will analyze the decisions they're making, even analyze things like their eye contact, when we use some of the headsets that have eye tracking and things like that. So we can pull in a huge amount of data, which often in an in-person setting is just lost or subjectively sort of fed back on by an observer. And so with all that data, we can then put it into a scoring system, which allows the trainers, the organization, to see what the standard is across all of their employees in terms of things like communication, soft skills, for these different domains like breaking bad news, leadership, or decision making. So that's some of the sort of soft skill stuff we capture. And then on the more technical skill side, like surgery, we're really interested in the human factors. So a lot of the video-based training we do, there are decision points in the videos at sort of points where the operation might kind of diverge depending on what the learner chooses, and we can track the speed of those decisions, why they're choosing those decisions, and again collect all that data and compare it across individuals.
And are these platforms, or are these services, are they reimbursable?
Yeah, so our sort of, I suppose, ROI for organizations is, I think, firstly, we try and get to payback in under 12 months, or as near to 6 months as we possibly can do for organizations. And a couple of the ways that we do that is firstly that by digitizing your training, you can actually significantly reduce the length of say an in-person course that you might do. So that will reduce kind of faculty time. It will reduce the obviously kind of spend on the venue, but more importantly, a lot of the data we track when we launch with sort of new customers is about employee engagement and reduction in things like anxiety and people feeling better prepared to enter a hazardous environment. And there's lots and lots of kind of data that we've got from our independent research. So we've done a couple of randomized controlled trials with the NHS back in the UK, where we've basically shown that the retention of information after a learning session using our system is significantly better than either in-person training or certainly just watching a video or reading a textbook. And what that then means is, for an L&D professional in a hospital, or a simulation center lead, if you are allocating a budget to each of your staff or employees for the year, and they're forgetting stuff, you're already losing quite a lot of that money. So with Virti, what we do is we're able to help people maximize any return on training investment and make their workforce better prepared for when it matters.
And when they're better prepared, I'm assuming this is going to reduce the anxiety, impact the burnout that they're experiencing, and then aid towards retention. Would that be correct?
Absolutely right. So, we plug into sort of HR departments, and I think one thing that's often forgotten is for real kind of high performing individuals, like anyone in the healthcare workforce, they don't necessarily want to be shown their worth through big pay packets or remuneration, although that's very nice. Often the best way to incentivize high performers is through education and giving them the best training possible. And a lot of healthcare professionals and residents, when they're choosing their residency programs, will go to the hospitals with the best training, or the highest exposure to unique cases and things like that. So you're absolutely right. It forms part of that hiring and retention process, as well as that employee well-being element as well.
And so you were able to basically demonstrate the dogs were eating the dog food. You had this, great success with early adopters, and then you sought your Series A. What are your plans with your Series A? What do you hope to accomplish with the new money?
Yeah, so I think when we decided to raise the Series A, it was really for sort of three key things. One was to expand our C-suite. So myself as kind of a solo founder, I wanted to bring on some really good people who could help scale the company, and run strategic elements that I was sort of doing literally everything through kind of 2019, 2020. We then wanted to just expand our whole team. So we were originally a team of probably around about 14, 15 people through most of 2020, doubling or trebling that in size over the next 12 months. And then the final piece was sort of bringing new products to market, and accelerating some of our tech development. So we've already brought out a couple of new things over the last sort of 6 to 12 months, such as these computer generated avatars that you can practice soft skills with. And we're going to be bringing out more components to this overall platform that really helps the workforce to get the best out of themselves.
And will you focus expansion on the US or stay in the UK or go through Europe? What's your plan?
Yeah, so I mean, the original plan, and I think
Which never lasts, apparently, right?
Exactly. I was going to say the classic phrase is, a plan's only good until you get punched in the face, right? So the original plan was scale up in the US state by state in a very sort of focused manner, but because of what happened during our sort of 2020 year, we've had people from all over the world actually kind of reach out. So we're now sort of quite aggressively scaling up in UAE, in APAC, as well as in the United States, around healthcare, and also some different verticals where we can help employees again to sort of reduce stress and maximize their performance.
And doing such a huge expansion, how do you control that? You're talking about different cultures, you're talking about different environments, you're talking about different regulations. So how do you manage that kind of expansion?
Yes, it's a really good question. So I think the first thing to say is that education, specifically healthcare education, is relatively similar across most geographies actually. So unlike sort of patient-facing things where there's lots of different regulatory bodies and things like that, for things like learning and development, relatively similar. A few differences, but nothing too challenging to overcome. I think in terms of scaling our workforce, that's one thing that we're very passionate about. So when I built Virti, I didn't just want to hit our mission of revolutionizing human performance for any employee anywhere. I also wanted to build the best kind of working environment where people would come and work for us and level themselves up and learn, and grow themselves as individuals. And so we built out a very strong company culture. So now that we've got employees in the United States, in Europe, and even in places like New Zealand and all over as a purely remote company, we've got a very, very strong company culture, which is be bold, be fast, be amazing. And that kind of aligns everything and everyone to our mission and what we do. And I think that's helped tremendously as we've been scaling up very, very quickly, especially over the last sort of 3 to 6 months, where we've doubled the team size in a matter of months. So I think that's a really good tip for anyone listening, which is make sure you get the foundations of your alignment and company culture in place before you start scaling.
And when you were talking to investors in the US, was there any pressure to relocate?
No, not really. I mean, I think for us, even before the pandemic hit, we were fully remote. So I was on a plane, most of the time, flying around the United States, flying back to Europe. We were hiring people in the US and the UK. We've got a US company and a UK company. So we always felt like we were a remote first organization. And I think with what's happened during the pandemic, that is something that lots and lots of people appreciate much more, because of everyone sort of working from home. So yeah, whenever we were speaking to anyone in the US, there was no pressure to relocate. There was no worries about us originally being a UK company and me having a Harry Potter English accent. So it was all fine.
Yeah, just blew my train of thought with the Harry Potter accent, but what I was gonna ask was, so we've heard some counter to that, right? Because I think the folks at Apple said, no, you can only do innovation by bringing people back, physically together. How would you respond to that? Especially around innovation.
Yeah, I think there's a real balance, and it just depends on how you do it and how your people operate. So in terms of like the engineering team at Virti, so the engineering team is super talented, and in order to get the best people possible, we wouldn't assume that everyone is originally from the same area, and equally we wouldn't make everyone move to the same area if their personal circumstances prohibited that. So some of the things that we do in terms of innovation, we kind of empower all our employees to take around about 20% of their time as time to work on fun projects. So a little bit similar to what Google did and 3M before them. So it really kind of stimulates personal development, innovation, and learning from working on kind of fun side projects. The other thing we do is we get everyone together very, very regularly in our sort of weekly cadence. So we do a Monday and Friday kind of stand-ups, with the Friday one reflecting back on the week. And then we do daily check-ins and team meetings all the time. And people are very kind of aligned to what they need to do and the product roadmap. I think then the other thing to say on that is, we don't, although we are remote first, we don't, preclude people meeting up in person. So we try and get everyone together in person, kind of, once a month, or, more frequently, depending on what quarantine conditions allow, really. So I think having that balance and that mix is absolutely critical. But yeah, I mean, I would never say that people have to be in the same space all the time. I don't think that's true. I think if you've got a very focused roadmap, you've got talented people, and you allow for creativity and innovation to kind of spark asynchronously, you can absolutely get around that.
So a lot of what the tools that you're using sound like Agile and Scrum. How important is project management to build this out and following project management?
Hugely. So again, we've been very lucky. So a lot of our engineering team come from games development backgrounds, where all the principles you just mentioned come naturally. And with myself having done tech development for my previous companies, where I was literally the only employee or one of a handful of employees, that comes to me very naturally as well. So one of the things that we sort of did quite early on was, rather than using things like kind of OKRs as an alignment tool, so objectives and key results, which comes from Google, we wanted to sort of really empower our people to be creative, to own everything they do in terms of project management, aligning to the overall roadmap. So we actually trademarked our own alignment tool called the Virti operating system, or VOS2, which roughly aligns everyone to their own personal vision and values, their objectives, their obstacles, and their strategy and specific metrics, with the specific metrics being most similar to traditional kind of OKRs and project management tasks. And that then maps to the team VOS2s and the company VOS2s. And so that really means that anyone that comes into the company immediately gets a perfect idea of where they fit in, what value they add, what they need to do, and when they need to complete projects by in terms of kind of quarterly cadence. And that's just worked phenomenally well for us in that kind of remote working environment.
So my last question for you is, do you still practice medicine?
I don't, unfortunately, not anymore. So I think when
And is your mother disappointed?
On a serious point, like that was a very kind of challenging conversation to have. I'd practiced orthopedics around about 6 years, been through med school and done surgical training, in total for about.
Now you want to do a
12 years.
startup? Yeah, that must have been a great call.
Yeah, so it's crazy, and to make matters worse, my parents are not, they're not sort of entrepreneurs. They don't come from business or startup backgrounds themselves. So quite traditional jobs. So my mum's a sort of retired school teacher. So that was a challenging conversation. But I think for me, where I was in my training, I was very close to completely finishing it. I was so passionate about the mission at Virti. I just felt, if I got to sort of, 35 or 40 or whatever, and I hadn't pulled the trigger on this, the main thing that I was going to be worried about was just, what might have happened, what could have happened. So that fear of missing out, rather than me like not liking working as a health professional, which I loved, particularly orthopedics, still love it. I think it's the best specialty. That was really the driving force. And I think as well, if you want to go and run a tech company, and specifically for me, where a lot of the driving force was about the mission, but also me learning how to do a lot of the things we talked about, like how to raise investment, how to scale our team, how to build a company culture. I'm basically a learning nerd, and that's my kind of why. That's what gets me up out of bed in the morning excited. And so when I sort of put all those reasons down, I just thought, I have to do this. Yes, it's a huge decision. Yes, I absolutely miss operating, and I miss the camaraderie of working in a team in fast-paced environments and helping patients. But what we're doing at Virti has the potential to massively impact people on a global scale, which is the thing that really, really excites me.
And as a founder, the founder role can be all encompassing. How do you break out of that? How do you take a break? What do you do to sort of shift out of work mode if you do?
Yeah, definitely, like hugely important. And I think there's two things. So firstly, for anyone who might not be watching this and is just listening on audio, I'm always dressed in sports gear. So
he's promoting Nike for us. Thank you.
Exactly. So I will my kind of way to relax is going to the gym, going out and doing CrossFit, doing some sports with my friends and things like that. So I think that's hugely important, and making sure that you fit in time around your busy founder schedule to do things like exercise, to make sure you get your 7 hours sleep or whatever it is per night, and you feel energized in the morning is hugely important, just from a self-care point of view. I think the other thing to also consider is perspective. And I think, coming from my background in trauma and orthopedics, where I would be, if I was on call or working like a 72-hour shift or something like that, I might be woken up at 4 a.m. to do an operation on someone who's come through the emergency department. And so, having been through some of those experiences, which they are stressful, they are life and death in some cases, everything else is then kind of filtered through a lens of, this isn't that hard. Like, yes, it's stressful. Yes, maybe a deal is on the line, or we need to hire or fire someone quickly, which are decisions you need to make. But then I never get like hugely stressed by them, to be perfectly honest, because I always have that kind of perspective, which I'm very, very grateful for. And then I think the final point I just say on that is, just make sure you build an amazing team. So I was probably quite guilty as a solo founder of doing way too much early on, and beyond, between our sort of seed and Series A, I was still running like all of operations, running sales, running marketing, everything. And so that's why now bringing on some really fantastic senior executives who not only can take ownership of that and do some of those roles better than I can, but it also unburdens me and supports me and helps me to learn from them to grow as well. So those are my kind of 3 tips for anyone listening.
And so if anyone's interested in what you're doing or where things are going, where can they find you?
Yeah, definitely. So you can basically access our website at virti.com, virti.com. We're Virti Labs, VIRTILABS across all socials. And then I've recently started putting down a lot of my thoughts around this, and I've actually mapped out our Series A process in my kind of CEO blog, which is alexanderfyoung.com. Really try and share some of these things that I've been through, because everything from raising investment to scaling a company is difficult, and there's no manual to do it. So I think it's really important for people to share everything they learn on that journey.
So we will make it a point to put those links below so that people can find you and look, follow that information and your journey. We appreciate your time very much. I'm sure you're very busy, so we'll let you get back to that. Again, thank you very much, and we look forward to great things from Virti and yourself. Thank you.
Absolute pleasure. Thanks so much.
Absolutely.